Good evening, everyone. Welcome to my IVF Answers platform and the European Fertility Society that has been created to support, raise awareness, and educate patients struggling with fertility. I am Sophia Meleti, Senior Fertility Midwife and an IVF Coordinator at Pelargos IVF. Let me inform you that this event is anonymous, will be recorded, and will be uploaded to my IVF Answers YouTube channel. I hope that you can hear me well. I guess you're all hearing me well. I'm very happy being here tonight and that we're given the chance to discuss about the IVF process and the costs at Pelargos IVF in Greece. Let me tell you a few things about us. Pelargos IVF is a medical group made up of various specialists in order to have a holistic approach to the fertility. Our main fertility team consists of our scientific director, Dr. Karpousis, two collaborating doctors who are French and Italian speakers, and midwives coordinators that accompany and support our patients at every step of the way. Specialists from other medical and paramedical fields are working with us towards the best possible outcome. As an independent medical group, we have the chance of collaborating with state-of-the-art laboratories of our choice, which also gives us the chance to generate our own statistics. We collaborate with the Institute of Life, an IVF center, which is located in the premises of a large maternity hospital in Athens. Institute of Life provides the biggest laboratory in Athens, staffed by Western-trained and internationally known embryologists. In the lab, we applied artificial intelligence systems and time-lapse RI computerized system, which gives a great benefit, since it leads to an enhanced decision-making, minimize the human errors, and improves the overall chances of IVF treatment. What makes us different, what sets us apart, is that we have a dedicated and holistic approach to each individual, as a patient and as a person. Our treatments are personalized, and every case is treated differently based on the medical history, the results, the needs, and the expectations. We also provide holistic treatments by covering all the aspects of IVF. We provided dedicated care. Doctor is dedicated to the patient, and our midwives coordinators are dedicated to each patient, providing their assistance at every step. We have a worldwide network of collaborating clinics and laboratories that support our patients abroad. We are always here to support you and answer your questions. While the digitalization that we implement simplifies and improves the service to our patients. Our patients also have the chance of using our application through which can contact with us, can communicate with us, as well as have access and follow up the progress of their treatment. Of course, we couldn't overlook of supporting our patients with their accommodation and their navigation in our country, and therefore we provide also concierge service. As the majority of our patients are coming from all over the world, we have found ways that facilitate and simplifies the process of the treatment. As a first contact with us, we provide a free initial chat with our scientific director, Dr. Karpousis, in order to have an overview of your case and discuss all the possible aspects and procedures of the treatment. After your meeting with doctor, you will receive a detailed email that includes all the costs of the treatment and all the necessary information about the procedures and the required tests. Since we work with a set number of IVF cycles per month, you will be requested to book your treatment in advance. And the deposit that you will need to pay will be subtracted by the total cost. Doctor will evaluate thoroughly your medical history and your results and will instruct a personalized treatment plan for you. Also, a midwife coordinator will be assigned to you in order to help you and support you to follow the plan and make the next steps. You always have the chance to undergo your treatment here in Athens with us, but also you have the option of starting and undergoing a part of the treatment in your country. And if needed, of course, we can provide you with a medication as well. Here we can see some of the required tests for starting an IVF treatment. For example, the AMH and the antrofollicular scan can provide useful information about your ovarian reserve. And this is a very important information that guides us for the most suitable protocol, while TSH and FT4 provide information about the thyroid function that can affect the stimulation and a possible pregnancy. Since the sperm always can make an impact in the success of the treatment, it's always good to have a sperm analysis. Keep in mind, though, that based on your case, depending on your medical history, maybe some additional tests will be requested. For example, we may need to investigate further the male factor, or we may need to investigate further the lining of the womb. All these tests that you can see on the slide can be provided by our clinic, of course. If you would like to have an overview of the treatment stages, then we'll start with the ovarian stimulation, getting to the egg collection in order to pick up the oocytes, fertilize them with the sperm, create the embryos, and then getting to the embryo transfer. The duration of the treatment is always an important factor when someone is trying to organize the steps ahead. The ovarian stimulation usually lasts around 14 days, starting from the first day of your cycle. And depending on your case, doctor would advise if this menstrual cycle should be spontaneous, estrogen priming, or provoked by contraceptive pills. During the stimulation, regular evaluations will be required in order to follow up the follicular growth and adjust the doses of the medication. On a normal SORT antagonist protocol, usually the injections last around 9 to 12 days and then follows the egg collection. After the egg collection, though, we have two options. The option of a fresh embryo transfer or freezing all the embryos through vitrification. If freezing all the embryos is the case, then you will need to come back for a frozen embryo transfer after an endometrial preparation. The endometrial preparation may include the administration of estrogen and progesterone, or may be involve downregulation with the use of generate analogs. More rarely may concern natural or semi-natural cycles, but this depends on the case. A typical endometrial preparation with estrogen and progesterone would last around 20 days. As I mentioned before, you have the chance of starting and undergoing part of your treatment in your country. And this way, we can minimize the duration of your stay to Athens around 3 to 4 days. If planning, though, to have a fresh embryo transfer, you would expect this most likely to happen 5 days after the egg collection. Of course, during your treatment, your midwife coordinator will be always there to support you, inform you about the medication, inform you about the purpose of the medication, and teach you how to use them with a variety of ways, such as video calls, YouTube videos, and whatever may be needed. The pre-implantation diagnosis, genetic diagnosis, can be a primary topic during an IVF treatment. Let's see what is that, when is advised, and how can have an impact in the success rates. There are three types. PGDA is the most common type of pre-implantation genetic diagnosis. When we have female age over 40, recurrent implantation failures or recurrent miscarriages, all these indicate for PGTA. Let me remind you though that in the lab we use artificial intelligence systems. So for cases that will not go ahead with PGTA, there is also the alternative of an artificial intelligence system that predicts the chances of implantation. Here we can see two other types of pre-implantation genetic diagnosis, the PGTSR and the PGTM. PGTSR is applied when one of the parent has a known structural rearrangement on the DNA that can be inherited to the embryo. And the goal is to detect the embryos that do not carry these abnormalities. PGTM, though, can be applied and typically is applied when one parent or both are known carriers of a genetic disorder caused by mutations to one single gene. And the goal is to detect the embryos that do not carry these specific mutations. Forgive me, I didn't mention and I didn't explain what exactly is the PGTA, which is the most common option as well. PGTA analysis aims to identify the embryos that have the correct number of chromosomes, and this way can increase the chances of a successful pregnancy and reduce the risk of miscarriages and genetic disorders. Of course, you will have the support of the embryologist and the geneticist in making your decisions about all these tests, of course, for explaining the results and all the aspects of moving forward. During your treatment, you always have free access to your midwife coordinator that is always there to support you. And of course, you have the opportunity to discuss with a doctor if needed. Here you can see the costs of the treatment. We follow an all-inclusive policy without hidden costs. All costs are mentioned in the initial email you receive, and this gives you the chance to organize yourselves and your finance in advance. The total cost of an IVF cycle includes the ovarian stimulation, of course, with a personalized protocol, the egg collection, the fertilization, the blastocyst culture, the cryopreservation of the embryos for 1 year, and of course, an embryo transfer. In case you're undergoing your treatment here in Athens, all the scans that will be performed are included to the price as well. Some additional costs, though, may come from the medication, from the blood tests, or the pre-implantation genetic diagnosis. Here you can see in detail the costs of its type, PGT, and the costs of the blood tests, the approximate cost of the medication, which can vary, of course, because it depends on the protocol. We have also packages for natural and semi-natural cycles. In general, the payments are supposed to be done step by step during the treatment, and you pay only for services that you receive. And the only exception on this is the natural and semi-natural cycles packages that need to be paid in advance. To summarize, Pelargos IVF offers an innovative and evidence-based medical guidance, a holistic and personalized approach, the use of our network in order to be able to have part of your treatment in your country, straightforward processes, and psychological and emotional support. Always remember that you deserve the best possible guidance and support during your fertility journey. And this can only happen by choosing the right allies for it. Thank you for accompanying me so far. Let me remind you that the event is anonymous And feel free to express yourselves, make your questions, and I'm more than happy to discuss. Let me let's see the questions that you have already started. I'm very happy. Let me check. I'm sorry for the waiting. So just a second. Okay. Hmm. Give me some time. I'm sorry. I think that we have a lot of questions that are big questions. I'm trying to, summarize a bit the questions. Okay. Time from sperm sample to ICSI. Can you tell about duration and risks if this takes too long? And what is too long? Okay. When we are at the clinic and ready to do the egg collection, the same actually, let me explain the steps. When we are about to have the egg collection, the couple is together most of the times, and we start first from the egg collection. Once we have the eggs, then the embryologist evaluate them. And then we call the gentleman to give the sperm sample. It happens directly. When the eggs are ready and the sperm is ready, then we proceed directly. Sometimes maybe it's required to bring the sample, and this is advised to be done within 30 to 45 minutes. Let's see more questions. Can more than a single embryo be implanted during transfer? Yes, yes, of course. The maximum number of the embryos that you can transfer per time depends, of course, and on your age. In general, for women less than 35, the maximum is two embryos. So you can either transfer one or two embryos. There are cases, though, for women from 35 to 40 years old that have a medical history of recurrent failure, implantation failures or recurrent miscarriages. And in this case, they can transfer even three embryos. Also, the maximum number of the embryos is three for women over 40 years old. If we offer treatment with donor eggs and sperm, yes, we cover all the aspects of IVF treatments. We provide egg donation treatment. But also, this is a case that we are planning to discuss in detail in the future. Hmm, some other questions. Let's see here. The doctors recommended PGTA and PGTM and IVF as the next step. However, we are unsure about this. We were told that with an additional payment of 5,000 on top of our Swiss health insurance, we could proceed with PGTA IVF. However, we are not fully convinced, both due to the high cost and our concerns about their experience on this field. What do you recommend we do? Where should we start? And what would be the approximate cost? Okay, it's a very interesting question because it seems like it is a couple there that is dealing with specific genetic disorder since the PCDM is advised. It's really important to have the proper guidance from specialists on this field. It's really important to feel safe, to feel the trust with the people that you're going to move forward. Obviously, if they have suggested you PGTM, there is a specific genetic disorder on your carrier, or maybe your carriers, or one of your carrier. PGTA is an additional test to the PGTM analyzed embryos. The cost, yes, can be a bit more than expected sometimes because are very special tests. Let me let me go. Let me go back to our presentation and see here the costs of the PGT. You can see here the PGTM costs. Let's start actually by saying that PGT, the pre-implantation genetic diagnosis, requires biopsy on the embryo. Then we freeze the embryos and we send the cells for analysis. The cost of the biopsy, you can see here, is 740 euros. We need also a setup on the embryos for the common genes. And here you can see also the cost of a common gene setup or for rare genes. And then the analysis cost per embryo. To these embryos, if come back these embryos like normal to the normal embryos, then we apply PGTM on them, PGTA, I'm sorry. What you need to do? First of all, you need to find specialists that can guide you properly on this matter. Pelargos IVF can provide a dedicated and evidence-based guidance on these matters. So the first step is to discuss and see what exactly is the genetic disorder, what exactly are the steps you need to follow, and have a proper consultation on this matter. What all this mean? What are the steps? Because it's not just a straightforward IVF process. You need to be fully informed about all the aspects of PGTA and PGTM in detail in order to make your decision, because genetic disorder to genetic disorder can differ. Let's see, I think we have another one in regards to PGTA. Let me check and find the question. Mm, okay, here, for example, we have another case. We have been married for 9 years. My wife had vaginismus for the first 5 years, and later a fibroid was found in her uterine wall, which was reduced to 1 centimeter through surgery. After that, she had 3 miscarriages. Most recently, we went to endocrinology department at Zurich University Hospital where all tests were conducted. Genetic screening, ultrasound scans, and a biopsy were performed, but no issues were found. Her eggs were reported to be in good condition and no fertility problems were detected. My partner also underwent sperm analysis, which was a good quality genetic testing and blood tests, and no issue were found. There are cases that seems to have that seems to have unexplained infertility issues. But I don't see here the age factor. I mean, that is maybe there are, you have been tested for several things, but the age factor always play a very important role. For example, if you're over 40, the chances are not the same, and PTTA can be very useful for your case. Also, you mentioned miscarriages. Miscarriages can also happen due to abnormalities in the embryo. So, still, a PTTA would be a very useful way to go ahead, since you have tested also the uterus and all that. By any means, for more medical questions and thorough medical advice, you always have the chance to send us your question through email or book a consultation with Dr. Karpousis that can guide you and advise you thoroughly based on your medical history. Let me see other questions. What is the age limit for IVF in your country? The upper age limit in Greece is the 54 years old. Keep in mind though that for women over 50 years old, there is required a special permission from the Greek authorities. The lady needs to go through some baseline tests to be evaluated by a cardiologist, by a breast doctor, and a gynecologist, and provide medical letters to the Greek authorities. This is in order to prove and that is safe to go ahead with a possible pregnancy. And of course, it's for her safety. I see that there are a lot of questions about egg donation. It seems like it's an interesting topic. Let me keep the answers for our next meeting that will discuss everything in detail. There are some there are some questions that patients make in regards to the process of IVF treatment that are very simple questions, simple answers that can help a lot the patient to get prepared for what is coming. For example, uh, what should expect during the collection and what I should expect after the collection. During the collection, you will be asleep, you will be under sedation, and you will not, basically, you will not feel anything. Most of the women recover very smoothly from the sedation. It's a light sedation, and they are getting back to their activities very soon. A bit of cramps, a bit of spotting, This is something that you may expect, but it's normal symptoms. When Another question: when will have when will have the update about the eggs, about the fertilization, about the embryos? On the day of the egg collection, we will let you know about how many eggs, how many oocytes have been retrieved. The embryologist needs some time in order to figure out the maturity of the eggs, the quality of them, and they do the fertilization on the same day. Next day will be the day one of fertilization. Is the day that we will update you about how many of the eggs have been successfully fertilized. So how many embryos day one you have. Um, then follows states that we let the embryos to grow in order to reach the blastocyst states. So the next update most probably will be on day 5, that is the blastocyst states, day 5 or day 6. If it's requested, can have also on the day 3 an update. Mm. I see there are some questions that refer to adenomyosis, for example. Yeah, adenomyosis is a very common issue that can cause or can affect the treatment, especially during the endometrial preparation and the embryo transfer. It doesn't affect the stimulation. It affects the embryo plantation maybe. Um, this is the cases. In these cases, most of the times we use the down regulation, which generates analogs that can help with that. Still, there are some more medical questions that I would be more than happy to discuss and answer to you, but I believe that would be best to discuss in detail with Dr. Karpousis. How important is ovulation for transfer for people with implantation failure? Is letrozole helpful, and how many cycles before do you recommend it? In terms of IVF, um, we we actually we kind of control the cycle and the ovulation by taking estrogens, for example. Um, while we are taking the estrogens, uh, the doses can control a bit the ovulation, can prevent the ovulation because the purpose is to have a thickness of the endometrium, and we need some time to make it. And we need to control the ovulation in order to synchronize the endometrium with the growth of the embryo that we are going to transfer. So, in terms of IVF, I would say that ovulation is something that we control by medication through medication. And about letrozole is used in semi-natural cycles, in modified cycles. In modified cycles, we use letrozole in order to control a bit when the ovulation will happen. And after the ovulation, to um, start the synchronization with the embryo. So still, the the use of letrozole is not so common in terms of cycles that most of them are medicated. If EMH is low, is it better to have a natural or semi-natural cycle to collect the eggs? That's a good question. A low AMH usually is followed by an antral follicular scan with a low reserve, with a low ovarian reserve. There are, there are some times that a high dose protocol maybe that could help, but there are other things that doctor will evaluate as well for making this decision. And there are a lot of cycles that we follow semi-natural cycles when we have a low AMH. Yes, most of the times, especially if we have like one, two, or three eggs, a natural or a semi-natural cycle is recommended. But always remember that everything depends on your case. Every case is different. The medical history is different. The reaction is different. The age factor also plays a role. Okay, another question about donors. Mm, okay. I see a question about DNA fragmentation and the sperm quality, and that have already stopped smoking. The environment, yes, can play a role. The lifestyle can play a role in the sperm quality. The DNA fragmentation is sometimes related with the high oxidation on the sperm as well, which um, is also related to the environmental um, circumstances. But of course, there's also um, the genetic part of this. Regular ejaculations can help, especially in high oxidation. Avoid any chemicals, having a healthy lifestyle, avoid stress, smoke, alcohol, and supplements that helps with the oxidation as well. Antioxidants, for example. Sometimes DNA fragmentation that refers to broken or damaged DNA on the sperm sample is related with the high oxidation, and this is the reason I mentioned this as well. What special testing plans do you offer? Special testing plans. Mm, I'm not sure what exactly it refers to, where exactly it refers to, but as maybe you show on the slides, sometimes we need to investigate further the lining of the womb. This can happen during a hysteroscopy that we put a camera into the womb, we investigate further the endometrial cavity, and while we're doing this hysteroscopy, we can take biopsy of the endometrium and send for analysis for specific tests that check for chronic endometritis, immunology issues, or the implantation window, for example, that maybe is displaced to some women. What are some extra tests that we usually advise after recurring implantation failure, recurring miscarriages? This is just an example. After removal of fibroids, how many months after do you think IVF can be tried again? I guess you're referring to laparoscopically, to a laparoscopy, and after a laparoscopy, IVF should be actually an embryo transfer should be take place after 6 months, I would say. But it depends if it's true this happened to you laparoscopy. My spouse having an appointment at Pelargos clinic tomorrow, and I would like a suggestion, special treatment plan, and cost, please. We're very happy to welcome you tomorrow. We're very happy to see you. Um, we will, doctor will be there to discuss with you your case, evaluate your medical history, your results, and of course, after this evaluation, we'll be able to provide you a personalized treatment plan. In regards to the cost, depends on the treatment type, since we cover all the aspects of IVF. But if we're talking about IVF with own eggs, then the total cost is 3,250 euros in total, including all inclusive, as I described in the slides before. The ovarian stimulation, the egg collection, embryo transfer, blastocyst culture, freezing, and everything. Mhm. I am 53 years old with 7 donor egg IVF transfer using different donors over 4-year period. I have taken NK cells blood work, endometrial receptivity, almost every blood test possible. I have no health problems. 3 tiny fibroids that 5 different doctors diagnosed are not a problem. Is there, um, it seems like we don't have the whole question. I guess it's about the age limitation. It's a question that we discussed earlier. The upper age limit is 54 years old and require and the special permission by Greek authorities is required. Let me mention though on this matter that in our clinic we provide whatever you need in order to make your application for this. We can book all your appointments at the clinic and we can provide you with the medical letters you need. And of course, our coordinators to help you to do the whole application. Mm, okay. Um, do your clinic offer IVF with their own eggs for women over 50? Again, the age factor is an important is an important factor to the whole treatment success. Um, we are, we have we feel always obligated to be straightforward and be, um, and speak about the truth about the possibilities that a woman has at her 50. The most suitable treatment for women over 50 is the egg donation. There are some cases that, of course, if they are about to do this progress, we are always there to support, but it's not something that we in general we advise, since the we know that the possibilities that are extremely low, and we don't feel like just go ahead with a treatment that we believe that is not suitable for you. But of course, always the choice is up to you. Okay. I feel like we don't have any further questions here, but I believe that there are some questions from my experience that would be very helpful to know, especially for someone that is exploring now this IVF world. Um, for example, we discussed about the egg collection, and we discussed about uh, when should expect the updates about the embryos, and when would happen the embryo transfer. Yeah, as a fresh embryo transfer. A fresh embryo transfer would happen 5 days after the egg retrieval. What about the frozen cycle? What does it require? During the ovarian stimulation are required regular examinations every couple of days, for example, in order to follow up the follicular growth. During an endometrial preparation, though, it's not needed to have so many examinations. It seems like to be a more easy process. The medication are different as well. Um, Most of the times during an endometrial preparation, the medication are pills or pessaries, so it's even more easier. Of course, you always have the coordinator and your midwife with you, and even during the IVF, the ovarian stimulation will be there to support you with that. When we get to the embryo transfer is a short procedure. Most of the times, happens without sedation, so you will be awake during the whole process. It lasts around 15 minutes. It's an easy process, a short process. It's like a smear test. It's a bit uncomfortable, but it's not painful most of the times. We put the catheter through the cervix in order to release the embryos into the womb. And what should expect after the embryo transfer? How would expect your activities to be, your usual days to be? Well, remember that you're a healthy person, and remember that pregnancy is it's a normal situation or a normal condition of the woman's body. We don't expect we don't expect you to stay on the bed. We don't expect you um, to stop everything you're doing and just wait for the results. You're a healthy woman, but you should consider yourself as pregnant and just take it easy. Take care of your diet, take care your mentally health. Avoid, of course, smoke, alcohol, and all that stuff. You don't expect to have also any symptoms. Very early stages of pregnancy. doesn't have always symptoms. So you should always keep that in mind as well, because there are many women that are feeling very anxious, like I don't feel something, maybe something is wrong, maybe something is not going okay. It doesn't work like that. Sometimes we don't have symptoms, and it's not always something bad. So this is the process of an embryo transfer as well. We have already done tests in a clinic in our country. Do you contact them, or we will have to provide you with the files ourselves? Um, okay, we have a worldwide network of collaborating clinics and laboratories, laboratories for all the required tests that you may need to have during your treatment. Uh, it is always best, though, to provide the results on yourselves and make sure that we have a direct contact. Most of the times, our patients provide the results by themselves. Of course, this depends also from the clinic. Some clinics, some laboratories prefer to communicate with us about the results. My husband needs to be there during the semen to collection. He's not able to do it on his own. On the day of the egg collection, could we do our semen collection first and then the egg collection second? Okay, this is something that's common. It's not always easy to go ahead with with a sperm sample. Sometimes the stress, sometimes it's all the procedure that can get a man very anxious. So yes, this can happen, and sometimes we just prefer to collect the sperm together. Maybe okay, maybe you can be into the room, but maybe it's better after the collection. But still, if you need to do it before, then yeah, then yes, it can happen before, a little bit before the egg collection, though. Of course, by collecting the sperm sample and getting this directly to the lab, it's much it's much different than collecting at home and bring to the clinic. I mean, like it's better to do it in advance if it's okay, if you're in the clinic, so that can the lab take the sperm sample and start the process. Mm, I am 38 years old female and my husband is 41. I would like to send your medical history and test results. If we can make a decision together, we would like to start the process with you. I have written a detailed message above, but I can also send you a file. If you provide your contact information email, I will send you our documents. All right. So it seems like you need a proper consultation with Dr. Karpuzis in order to have a thorough medical advice. Uh, you can always contact us through email, through our website. Our email is uh, info at pelargosivf.com. And of course, you can contact us through our website. Um, you can book your consultation online. We will guide you for that. We will send you a link that you will get you to a calendar link to book your consultation. Of course, you have a file. Yeah, of course, you can send, but you need to book in advance your appointment with doctor and Let me clarify that you will need to book a proper consultation in order to have a thorough medical advice based on your specific history and results. Doctor will need to evaluate all the aspects of your medical history. So the 15 minutes we provide as a free initial chat most probably will not be enough for this. Do you have a sperm bank or do I have to bring my own uh, sample of sperm? Would you say it's be okay for one time? I'm interested in an open ID release donor for intrauterine insemination, which I would like to choose. I would not like the clinic or the hospital or the state to impose the genetic type of sperm on me based on my supposed traits as they do in clinics in Spain and other countries. I am interested in young sperm of excellent quality and motility. I'm 46 years old. I am healthy and have never had a miscarriage. I also do not use contraceptives. My tubes are okay. I do not smoke. I do not drink alcohol. I do not take drugs. I'm vaccinated. Although I caught the flu despite my vaccinations, I have three oocytes in excellent condition in its tube when I menstruate. Thank you. Okay, there are two very interesting topics on this question. Um, let's start about the sperm. Yes, we have a cooperating sperm bank that we can can put you in touch in order to find the most suitable donor for you. What about the IUI? IUI doesn't have the same success rates with IVF. Don't forget that we are speaking about 46 years old. So this means that you have more possibilities of abnormal chromosomes in your oocytes. Maybe you see three of them in your ovaries and look fine and you have menstrual cycle. But biologically, women over 40 have increased chances for for creating embryos with abnormal chromosomes. And this is the reason we advise also for PGTA in these cases. With intrauterine insemination, you will not be able to have this. And if you need if you need to discuss further about the IVF or the intrauterine insemination, we're always here to discuss about the success, to discuss about the possibilities. Okay, that you don't have miscarriages. I guess that you haven't had also any implantations. There are plenty of things that you can discuss with the doctor in order to make your decision about how we'll proceed. We definitely wouldn't advise for an IUI when we have the option of IVF, and especially in 46 years old, if you want to improve your chances, you would consider the PGTA as well. What do you think of high NK level in blood? Some say it doesn't mean much in abortions. When you have NK level in uterus, which test can you make? That's a very good question. It is true. The NK level in blood is not the same. It's not as accurate as having the test directly from the lining of the womb. For checking NK, are related to immunology issues. For checking immunology issues in the lining, you should do IMAP test. The IMAP test, as I described previously, can be done during hysteroscopy while we collect sample and we send for analysis. I know that there is a lot of information that you need to process, so you may need some more time for having your questions. Feel free. Any other questions? Do you need to take medicine if your NK levels in blood are high to avoid abortions? Yes, most of the times when we have increased NK levels, we advise for steroids, for intralipid, and any other medication that can affect and can help with immunology issues. Okay, I see that it seems like you have made your questions, and I'm more than happy that I was here to answer these questions. Um, Maybe would you like to have an overview of all the whole stages of a treatment? Most of you are going to explore the IVF treatment for first time. So I think that would be really helpful to take it from the beginning and to have an overview of all the stages. So basically, when you're about to consider your fertility journey with us, you will have the chance to contact our scientific director, Dr. Karpousis, in order to discuss and have an overview of your case and discuss all the processes of a possible treatment. You will receive in detail all the costs or the procedures and the required tests that you need before starting the procedure. Then you will need, if you decide, of course, to go ahead, you will need to book your treatment. And once you book your treatment with us, you will have a personalized treatment plan by doctor and a midwife coordinator that will accompany and support you at every step of the way. You will start with the ovarian stimulation that lasts around 2 weeks. During the stimulation, you will have regular examinations in order to follow up the process until the time that we get to the egg collection. At the egg collection, we will pick up the oocytes, we will fertilize them, we will create the embryos, and then we will get to the embryo transfer. The embryo transfer maybe will be a fresh transfer, or maybe will be a frozen embryo transfer. So after the collection, either you transfer embryos, either you freeze embryos, either you do both. If you choose a frozen embryo transfer, then you will need to come back for the frozen embryo transfer. You will need to prepare your lining. We always give you the chance to start your treatment in your country. We have a worldwide network that can help you and can support you for all the required tests before and during the treatment. And also, this is applied for the ovarian stimulation. So this way we minimize the duration of your stay here in Greece. And you will be able to come here for the egg collection or for the embryo transfer and stay only for 3 to 4 days. During the whole treatment, you will have your midwife coordinator that will be supporting you, will be assisting you at every step, will be there to answer your question. Your questions will be there to teach you about medication, help you following the plan. And of course, you will have a free access to the doctor if it's needed to discuss something about your treatment. And hopefully, when we get to the pregnancy, the embryo transfer, and then the pregnancy, you will have also the support for the early stage pregnancy. I hope that all this process, I hope that it was helpful to hearing all this information about all this process, especially for someone that just starts with all this. It can be chaotic, it can be stressful, but if you're having the right persons with you, then everything will be much easier. Thank you very much for accompanying me all this time. Thank you very much for your questions, and hopefully we'll meet you again very soon. Have a good night, everyone.